Hey guys, Dr. Christine Vaccaro, your gynecologist, sexual medicine specialist in the DC area. And I'm going to talk to you about one of my favorite estrogen replacement therapy medications because it is super low maintenance. You just change it every 90 days and it gives a nice steady state of estradiol, which is bioidentical. It is called the Femring. It is super wonderful, nice and soft and flexible. But the question that I normally get is, well, number one, how do I get it in? Number two, is my partner going to feel it? Am I going to feel it? And can it get lost? Where does it go? So all those sort of things are very common that women ask. So what I just tell women is this is very similar to insertion of a tampon. So you just squeeze it. Again, it's very flexible. Once you insert it into the vagina, which I have a little model here to show, you can't put it in the wrong place. There is no wrong space in the vagina. But as you can see here in my model, I placed it through the vagina, okay? And just for demo, I'm gonna show you, it's gonna then enter the pelvis. As it gets in just a little bit more, it's just gonna sit right here in the middle of the pelvis. The crazy thing is the upper vagina actually has a ton of space. Think again, a baby actually fits through this whole space, right? A whole baby's head can fit in the pelvis. So there's lots of room in the upper vagina, not a lot of room at the lower vagina, but again, that's how it stays in, right? It's tight at the lower vagina, but there's lots of space in the upper vagina. It's also why most women don't feel tampons, because once they're in, there's a lot of space up there and women don't feel them. You should not feel this when it's inserted. If you do, certainly let your doctor know, but that would be uncommon. Additionally, women are like, well, how do I get it out once I get it in and when I change it every 3 months? So I'm just gonna try to show you on my model again, here we go. So I've inserted a finger into the vagina, and again, the femring, that's where it sits. And all that's gonna happen is you're just gonna hook your finger around it, and then it just pulls right out through the vagina, just like that. So again, it's just hooking around it and pulling it straight out. So nothing complicated. Again, it's super, super flexible. All you have to do is reach in, again, find it, hook it, and pull it right out. So again, love this. Comes in 2 doses and very, very low maintenance. Again, change it every 3 months. Partners usually do not feel this. You can remove it during sex. Most women, though, leave it in because, again, it lots of room in the upper vagina. Continue to send in your questions about the Femring.